Thank you, Dr. Tina Bhutani, for joining us. Dr. Tina
Hi.
Bhutani is Associate Professor at UCSF and President and CEO of Synergy Dermatology in SF and an absolute psoriasis expert. So thanks for joining to teach us about biosimilars because they're
Yeah.
all coming out for Humira.
I know you've probably already gotten the requests to change to biosimilars and it's coming, yeah, for sure.
Yeah. So first question, because our patients are messaging all of us now because they're getting the letters, we're getting the letters.
Yeah.
A lot of patients ask, what's the main difference between a biosimilar versus like a generic medicine
Yeah.
as we kind of know
Yeah.
it?
Yeah. So yeah, I've had a lot of patients tell me, like, oh, so this is, a generic for Humira. And I mean, I get what they're saying, but biosimilars are a little bit different. So generic drugs are usually basically replicas of, drugs that are made by chemical synthesis. So like oral pills, topical medications. Like these are medications where there's a formula and you kind of replicate it, you recreate it, and then they call it a generic, and then they can put it on the market. They don't have to go through any clinical studies, no clinical trials, they just, are available. But when it comes to biosimilars, they actually have to go through a more rigorous process. These drugs are different because first of all, they're made inside of cells. We can't just like, put a formula into a computer and then have it replicate the drug. It's actually a complex process. And so because of that, the FDA does require that the biosimilars do have to do, some clinical studies, and they have to show that the drug is non-inferior to the original product. So in this case, Humira. So all of the Humira biosimilars that have come out have gone through, randomized trials where patients are treated with the drug. And so oftentimes what they do is they actually begin treatment with Humira and then they'll switch to the biosimilar in the clinical study. So they have to show that the efficacy doesn't decrease, that there's no like increase in adverse events or safety issues once they do the switch. And then many times they actually have to switch back to Humira and back and forth, and they do what are called interchangeability studies. So all this to say that there is actually, clinical studies and clinical data behind biosimilars. It's not just a replica of the drug. And with that, comes the confidence that these drugs probably do work just as well as Humira and probably are just as safe as Humira. So I feel comfortable, prescribing the biosimilars when I'm faced with that letter. The one thing that we don't know though, and because the studies are usually short term, either a year or or maybe less in some cases, we don't know what it means as far as like immunogenicity. So, do these drugs, are they more prone to like anti-drug antibody development? Do they develop more neutralizing antibodies over time? So those are the things we don't quite have a handle on. Like, will they lose effect more easily than Humira does? But, at least in the short term, out to a year or so, we know that these drugs work just as well as Humira for the most part.
Yeah, no, that's great. So at least we know we can at least tell patients it'll probably still keep
Yeah.
working
Yeah.
for
Yeah.
some
And I've
time.
had
And a lot of
patients
trials
switch
have been done.
actually. Yeah. I've had patients switch now multiple times, and I haven't really seen any issues, and the patients are still happy with
That's
the
great. And
medication. Yeah.
there's a lot on the market now. Do you, when the insurance sends you a list and they say we have two or three that we cover, how do you
Yeah.
choose between the two? What are some factors
I
to,
know.
um,
I honestly can't keep track. There seems to be so many now. I think there's 8 or 9 now for
yeah,
Humira, and so it's almost impossible. So, I take the list, and there are tables. So if you just Google, Humira biosimilars, there's these nice tables that you can find online. Because the things you want to look for is, for example, is the mode of administration the same? Like, do they come in pens versus syringes? What your patient was using with Humira. You want to make sure that they're using the same, citrate-free formulations, which is what we were, used to more recently with Humira, which is the less painful version, because there are some of the biosimilars that aren't citrate-free. And so if your patient was on the citrate-free Humira, you want to make sure that they're getting a biosimilar that's also citrate-free. There are some that are available in, different dosing. And so some are available in kind of the more concentrated, the lower dose or lower volume Humira version, some aren't. So again, these are things that you want to keep in mind when you're switching patients to make sure that they're getting the drug that's closest to what they were using before.
yeah, that's a good point. Because if they switch to something, it's like double the volume and it's painful to
Exactly.
inject, they're going to notice that.
They're gonna notice it. Yeah, yeah. I had the opposite happen today. Actually, I had a patient come in, says he switched to something. He must have been on the the pre-citrate-free version of Humira, like the more painful
Oh,
version.
wow. Yeah.
And then he switched to the
Was
biosimilar.
better.
He's like, there's no pain, it's better. So it's like, okay. Like, yeah.
That's fantastic. So thank
Yeah.
you so much. Thanks for teaching us about biosimilars.
Thank you.
Okay.
Bye.